Hi all, this is Mrs. Neary, and this is a discussion on general nursing theories used in nursing practice. And I know that sounds a little bit odd since the entire course is called nursing theory, and you wonder, so why do we have 1 week called nursing theory? And this is kind of going back to that structure of nursing theory where we talked about moving from the most abstract to the least abstract components, and we started out with the meta paradigm and philosophies, and then grand theories, models, models. And we're moving into nursing theory, which means it's a little bit more concrete and not quite so abstract, although these are still quite large theories. And so but they can be used in most nursing practices. They aren't so specific that they only apply to one area, but they're specific enough that actually you can pick the concepts out and possibly do some research on those concepts, or really start utilizing the concepts more specifically within your nursing practice. So let's delve into a few of them to see what I'm talking about. Okay, so here's the lesson outcomes, and again, not reading them to you. You should have these written down in the week in Blackboard as well as in this PowerPoint, which I will attach to Blackboard for you. So what is nursing theory, and what does it really mean if we're talking about these smaller theories, not the big models, which again sometimes are referred to as theory, but in the context of which we're talking about, what does it really mean? Well, nursing theory basically explains, it describes, it can predict, and prescribes nursing care. And so each one of the theories that we're going to talk about this week does that. It explains why nurses do what they do, describes how nurses should do it. It predicts the outcomes if you do it within the certain context of the theory. And it prescribes actions for the nurses to take, or at least steps in practice for the nurse to take in order to achieve the desired outcome. So, how does theory do this? It's a roadmap. It basically provides guidance and direction on how to render care. What kind of assessments to gather, what kind of implementations would be appropriate if used within the context of the theory, and it provides guidance as to concepts that are related and interrelated within the theory. And that will make more sense as we talk about the theories that we're going over this week. So basically, if you look at the two pictures, and if you all know the cartoons that are drawn, that without theory, nursing care becomes haphazard, and you get all kinds of flux all over the place. You don't have the map as to where you're going, and you're just kind of moving all about the place, trying different actions, just looking for a reaction. Where with theory, theory has a plan, it tells you where you're going, it provides the guidance and the framework within how you're going to provide care to a patient. Okay. So there's a few theories that we're going to focus on in this lesson, and again I'll reiterate this. You all have we have reviewed philosophies and we've reviewed models, and there have been quite a few of those. And this week these are the theories we're going to focus on, and so for the discussion board and the reply post, these are the theories you're going to use. You're not going to backpedal and go back to Orem or Watson or Clarissa Roy or any of those that we've already talked about. You're going to actually focus on these theories, or the theories that are posted in Blackboard for the week. And so you can see the difference in the names of these theories and models. And when we talked about models, the theorist's name was always in the forefront. When we talk about these theories that are a little less complex than the models, you actually have the name of the theory, and then the theorist who developed it is subscribed to it in a little bit later. So the 5 we're going to talk about is the nursing process theory in nursing practice, and that was Ida Orlando who developed that theory. Modeling and role modeling theory was from Erickson, Tomlin, and Swain. The theory of interpersonal relationship, and I know most of you all have probably actually heard of this one, and that's Paplow's theory. The theory of cultural care, diversity, and universality is actually called the transcultural theory, and that was Leininger, and many of you may have heard of that one also. And then the last theory we're going to delve into is the basic care needs theory. It's the oldest of all of these theories that we're going to talk about, but I believe that it's still relevant to nursing practice because it really gets down to the basics of what nursing does and is. Okay, so let's start off with just talking, and again, I'm just going to real quickly introduce these theories. The goal of me doing this is so that you can look at these and go, oh, well, that one sounds interesting to me, or nope, I think I like that one a little bit better, and hopefully that'll give you a focus as to what you're going to go into this week and learn about. Because remember, you really only have to really read about one of these theories. And again, too much in this short period of time for you to read about all of them. So we really just want you to kind of focus on one. And hopefully in this discussion, this short little video, you'll get a taste of each one of them and you can decide which one sounds the most attractive to you. So if we talk about Orlando's nursing process theory, and you all have learned the nursing process, and this is not exactly the nursing process that you are used to, the ADPI, assessment, diagnosis, implementation, and evaluation. But it marries that nursing process. And what Orlando says is that our nursing actions are within a process. You have to have a framework of a process of what you're going to do, or you're going to be haphazard about what you do. There were 5 concepts within her theory: nursing function, patient's presenting behavior. So how is the patient presenting? What is the nurse's immediate reaction to that care? And then she talks about the deliberative nursing process, which is a concept within itself within this theory. And then the last one is improvement on the patient outcomes. Orlando saw nursing actions as either good or bad, and it was interesting in that day she could call it good nurse or bad nurse. And what she said a good nurse was a good nurse focused on the patient's needs. Regardless of what else was going on around, that nurse who was good really focused on what the patient's needs were, where the nurse who was bad actually focused on prescribed activities. So regardless of what was going on with the patient, the nurse went in and saw the patient as a task to do, and there was something that had to get done, and that nurse was just going in and doing to get the job done and not really focusing on the patient's needs. So while this theory is similar, it is not exactly like the nursing process that you know or that you have learned about, but it is very interesting, and Orlando was not the first, but one of those pioneers who really broke nursing down into a process. And then we have modeling and role modeling. Modeling and role modeling, there were 3 theorists who actually developed this, and this was I believe it was in the 1960s and 70s. And Helen Erickson, who had a strong background in psychology, actually developed this theory, and her research was directed by Evelyn Tomlin and Mary Schwein, and this was an interesting theory because it was based on both the systems theory and some psychological reasoning. The theory itself promotes self-care, but as a nurse, what this theory says is that we as nurses have to model within the patient's worldview. So it's not us modeling good actions and behaviors or healthy actions. What modeling actually is that the nurse gets to know the patient, understands the patient's worldview of how they view their health and their illness, and then the nurse approaches care based on the worldview of the patient. That seems to make so much sense to me, and hopefully to you all. And you all have all probably dealt with patients who have been really difficult to reach, and sometimes that's because we are approaching their care based on what we think is best for them, how we would approach illness, and not necessarily and wellness, and not necessarily how the patient would perceive it. And so there's that distance, and if we can approach it on the patient's level and from the patient's worldview, we'll get better outcomes. So role model health concepts are all within the patient's worldview. So the next one we're going to focus on this week, and again, this is one you guys have probably heard from. I love this picture of Hildegard Paplau. She looks very distinguished there. And Paplau was a psychiatric nurse. And so the context of her theory, which is an interpersonal relationship theory, and she was one of the first ones to come out about relationship-based care. You know, we focus a lot now on Watson and these other theories that are relationship-based, you know, the one that Centera uses, which is a relationship-based model. But the very first nursing theorist to come out was Paplau. And what she found is that in her psychiatric practice is that it was all about developing that relationship with the patient in order to get a good outcome. And I think we've been taught this fairly in depth in nursing school. I would hope it's developing that relationship is so important. That's why nurses are the most trusted profession in the United States and has been for years. Paplau was one of the first theorists to actually discuss therapeutic communication, which was different than the normal way we communicate, the way I'm communicating with you now, the way that we communicate with our friends, our family, that the communication between a nurse and a patient was purposeful, and there was a process to that communication, and that process is what then would get us to the outcome we needed and wanted. She saw that relationship was based on 4 very distinct phases. The orientation phase, which is the phase where you meet the patient, you get to know one another, you figure out the how the relationship will go, what the context of the relationship is. The identification phase, where you identify the problems. Exploration is where you're working on getting to the desired outcome. And then the last phase, which is very important, is resolution or termination. And this is where the nurse-patient relationship basically ceases and stops, and the nurse goes on and the patient hopefully goes on to wellness. But those are the 4 phases of her theory. And then we have Madeline Leininger, and way ahead of her time. And for the students who are in the traditional program, they have learned a cultural care model, Geiger model, which has to do with transcultural nursing. But actually, Leininger was the very first nurse to describe transcultural nursing. And her background was with anthropology, and so she looked at things very holistically. She couldn't see taking one aspect of a patient and treating it and finding that you would actually get the outcome that you desired, or that the patient desired. What she saw was that there were things within the context of the patient that they learned within the culture, not just ethnic culture, but within the culture of the family they lived in, and the culture of the environment that they were in order you had to plan care that was culturally congruent to that patient's known living experience. And in doing so, you would be able to get the patient's buy-in, the patient's respect, and you would be able to render the best care for the best outcome. Because remember that each culture, or we base our definitions or ideals of health and wellness on our cultural beliefs, values, and such. And so Leininger said that we as nurses had to appreciate that and approach patients from their cultural perspective in order to get the best outcomes. So she was a very interesting person, and if any of you all want to use her this week, it would be great if you have not learned much about her in the past. And then the last one we're going to talk about is Virginia Henderson, and I like her for many reasons. And of course, it doesn't matter what I like, but I just like to share that with you, that I like her for many reasons. But she was one of the first nursing theorists and lived she lived actually all the way through the 1900s, but she did most of her work in the early and mid 1900s, and she was one of the very first nursing scholars. Actually, Sigma Theta Tau, which is the Honor Society for Nurses, it has a library that they have called the Virginia Henderson Library. So she was an avid scholar in nursing. She felt like nursing research was vital for us to progress as a profession. And she based her theory on, and you have to remember the context of the time she was coming up. So, but she said that there were 14 basic needs that patients had, and she could mirror those along with Maslow's hierarchy of needs. But she said that these 14 needs, nurses were responsible to ensure that the patient was meeting. These needs were being met. So breathing normally, adequate food and water, elimination, both bowel and bladder, movement and posture, sleep and rest, clothing, making sure the patient is clothed correctly for what's going on in the environment, body temperature, hygiene, safety, adequate communication to the patient, spirituality, that we're addressing the spirituality based on the patient's need to worship in the way that they would like to. Accomplishment is that sense of accomplishment that the patient can get through what we're doing to meet their health needs. Recreation, that all patients have a need and a desire for recreation. And of course, there is a need for learning. So those basic needs are within the purview of nursing practice. And Virginia Henderson, one other fact about her, she wrote the definition of nursing, which was the standard bearer definition, all the way up probably through the 1990s. And you can still find it if you've done any work in your professional nursing course. You may have researched Virginia Henderson and that classic definition of nursing. It is now not used as much, but it was around for probably 40 years as the definition of what nursing was. The other interesting fun fact about Virginia Henderson is that her very first job as a nurse faculty member was at Norfolk Protestant Hospital. And that hospital is today Norfolk General or Centera Norfolk General Hospital. And so she was a faculty member at our fine School of Nursing. It was her very first job before she moved up north. So there you go. At least you're in a school where Virginia Henderson used to teach. And so I think that that's actually very interesting. And maybe why I like her so much. I don't know. Okay, so what's due for this lesson? You have a discussion board due. And remember, you're going to choose one of those theories, the theories listed in Blackboard or the theories that I just talked about. You're not going to backtrack and go to the theories that we've already learned about. You're going to use these. You're going to read the chapter of only one of them, not all of them. You're going to really delve into one. There are also web links posted. And I believe for Henderson and Paplau, there is no chapter in your textbook. I believe for Henderson, I might be wrong about that one. There is no chapter in the textbook, but I have posted at least 2 web links that should have adequate information on those theories for you to be able to learn about. Then there is a posted case study both in the weekly content area and I believe in the discussion board. You're going to open that case study up and read it, and then you're going to devise a plan of care, a basic plan of care, based on how you would see that theory used to render care. How would you think that theorist would devise care based on the situation that's given to you in this case study? It is a great primer assignment for your very last assignment in the course, the individual assignment of linking theory to practice, where you will be devising a case study and applying a nursing theorist to care rendered to the patient. But in this one, we're giving you the case study, and then you will devise care based on the theory that you've chosen for the week. And basically the discussion board is what would blank do. So if you pick Henderson, it was what would Henderson do for that patient. Your reply post for this lesson is to a classmate who focused on a different theory than you did for the week's readings. And remember that both for the discussion board and the reply post that you need to have that strong link to practice. Okay, and if you have any questions, again, please don't hesitate to ask. We look forward to hearing them, and we will see you in class.